Telepsychiatry collaborative care is an evidence-based model of integrated care that includes on-site primary care providers supported by an on-site care manager and an off-site consulting telepsychiatrist. The SPIRIT trial was conducted in 24 primary clinics and enrolled more than 1,000 patients screening positive for PTSD and/or bipolar disorder. Results of the trial demonstrated that telepsychiatry collaborative care was highly effective at reducing symptoms and improving functioning.
So Yelm is considered a really small town. We have more people, more residents than services. So that's the imbalance of our community right now. My name is Joy Schaefer. I am a behavioral health manager with CMAR Community Health Centers, and we are located in Yelm, Washington.
My name is Dorothy Creech, and I was being treated for my bipolar and anxiety and agoraphobias. I never left the house, always stayed home. I'd go manic and kind of start screaming and yelling and freaking out. So I've been in therapy for 12 years and I kind of just gave up on it because I wasn't getting any better. If anything, I got more diagnoses added.
So my name is Dr. Greenberg. I was the primary care physician for a lot of our patients that were enrolled in the collaborative arm. We had limited access for behavioral health for so long. They did not necessarily have transportation, so it would be difficult to get to someone who did therapy or psychiatry that accepted their insurance within a reasonable location.
I'm Catherine Palm Cruz. I'm a psychiatrist, a clinical assistant professor in the Department of Psychiatry and Behavioral Medicine at University of Washington. And my involvement in the SPIRIT study was I was a collaborative care psychiatrist. The core members of the collaborative care team include the psychiatric consultant, a primary care provider, as well as a care manager.
Joy was our care manager and really was the focus for our patients, was the one who was able to follow up with our patients and connect them back to psychiatry, which was Catherine. I'm really serving to provide that consult and was always available if we had any questions or if we needed something different or were concerned about potential side effects. Really served to educate us on how we could best help our patients with PTSD and bipolar.
You just needed a follow-up appointment, or is there any?
Typically, the psychiatric consultant and the care manager will have weekly case reviews where they will look at the patients and look at the list of patients using a registry and see how people are doing, see who's of concern, who's not getting better, and see what interventions need to be implemented in order to improve the care of that patient, and then communicating that information in writing to the PCP and verbally as well if needed.
So, I've never even really had a chance or opportunity.
So with Dorothy, at the very beginning, our relationship is very explosive. So she has a very severe anxiety when she comes to the clinic. She does not want to sit in the lobby because of a lot of people. It's crowded. She's very resistant to options, and when we start talking, the first 3 months was just building rapport. We're just building that relationship, that it's okay to feel that way, but we develop a lot of goals and slowly introducing her with new things and some things that she can enjoy doing again. So like gardening, for example, and or even just doing crafting.
Look.
Oh my goodness.
Isn't she beautiful? That's my great-granddaughter.
towards the end, she learned how to trust, and she'll learn to come out a little bit of her house and then make friendships. And then she was able to host a Thanksgiving dinner and invited 4 of her friends.
Dorothy is a great example of someone who struggled with the fluctuations of her mood and the impact that it might have on her life, her ability to engage at a certain time. So doing collaborative care meant that we were able to engage with her when she was able to be there and to meet her with where she was at, to see her in the office, see her for one issue on the physical side potentially, and then link her back up with the mental health on the other side to continue to follow up.
I think it's a tremendous game changer. I think that the PCPs are very, very grateful for this support for some of these complex patients, especially when they can't refer them out, being able to treat them in the clinic. Usually in rural settings, there isn't really another choice.
It was a great program for me, I believe, and it's effective because you get a little bit more attention through the program than you would anywhere else, and that always helps.